Welcome to Atlas Insurance's Safety and Claims Management webinar series. We're excited about kicking off our new webinar series with today's topic, COVID-19, an employer's guide to reopening, the new norm. Employers are starting to see a number of resources that are starting to come in regards to reopening. But what Atlas Insurance wanted to provide you is a more detailed approach when returning back to work. It'll be vital for every employer to create a formal approach to COVID-19 and your return to work efforts, whether it's creating awareness within your organization, educating your employees on your specific procedures, and even more importantly, is holding individuals or employees accountable to follow your policy. These are areas that are going to be critical to reduce and minimize the spread of COVID-19 when you reopen. My name is Vincent Mio. I'm from Atlas Insurance Agency. I've been with the agency for over 20 years now. Currently responsible for organizational management and client consulting services, which includes the risk and claims units. Over the years, I've been able to help many businesses in the state of Hawaii in designing and implementing their safety and risk management programs. Atlas Insurance has one of the largest consulting groups in the state of Hawaii, and we have experts in all industries. In addition, we have a former OSHA inspector where we can assist clients with OSHA compliance. This is really so that we can provide value-added services to our clients so that they can get the best resources to them locally. With me today is Joy Baruso, who is a risk consultant with Atlas Insurance. Joy brings a number of years of experience within the human resources, operations, and retail industries. More importantly, Joy is bringing experience with COVID-19. He has been our Atlas resource for our clients since the time the pandemic has started. During the presentation, I want you to think about some of these questions. What has your company learned in regards to COVID-19? What are the opportunities that exist so that you can start creating the new norm for your company? Atlas Insurance Agency wants to provide you with the resources necessary to help you formalize your approach. This is basically the first step in the process in creating a policy and procedure that will help your business return back to work. You need this policy and procedure in place so that employees have something to follow. But more importantly, employees have a responsibility to follow your policy and procedure, and that you can hold them accountable to follow this. In the end, you as a company are responsible for the safety of the work environment.
And as Vince has mentioned, those questions to consider are definitely top of mind. And as you consider those questions, you also consider the work challenges as your employees return to work. Social distancing. How are we going to separate our employees to be 6 feet apart, whether it's their desk furniture, whether it's break rooms, whether it's restrooms? Is it even possible, right? The line of work that we're in, can we even separate them? What about those employees who might have chronic health conditions? Can we allow them to continue working from home? Is that even an option? Absenteeism. As we know, a lot of our services are connected and interconnected. So childcare, right, might be an issue, or transportation. Bring employees back too early. Do we have the right protocols in play? Do we have the right controls in play to try to protect our employees? And then you ask, well, are employees comfortable with returning to work? And I think that's where having a guide that's transparent and leadership that can communicate this message to the employees is really critical. And the exposure to COVID-19 as a whole is certainly something that is the responsibility of an employer and the responsibility of an employee, because we know that folks can walk around asymptomatic. So what are we going to do to try to mitigate the risk of exposing our employees to COVID? When we talk about facing challenges, we also want to discuss what is happening outside of Hawaii. So what are the US recovery efforts as we know it? We do know that some states have partially opened, some states are beginning to open, and some are still shut down or restricted, like Hawaii. At the beginning of early May, when they started reopening some of these states, we saw a surge of new cases, for example. May 5th to May 6th, there was 20,000 new cases, and May 6th, it would jump up to 25,000 new cases. So that surge increase certainly doesn't help. Actually, it's very worrisome as people begin to travel. And so some of the issues with the increase of new cases had to deal with testing, disjointed services such as childcare and education bodies, inconsistent reopening of states and counties and cities. Businesses and travel had their own set of guidelines, and so it caused confusion. And there are some major industries that have been hit enormously by this pandemic. Retail, food and beverage, transportation, hospitality, manufacturing, just to name a few. And along with that, you have the upward trends of unemployment, which researchers and studies show might reach up approximately 20% by the end of the year. And as some industries begin to open, some states begin to open, the tourism industry for Hawaii will affect us. And studies are showing that return to normal business for tourism won't begin to happen till end of the year or even next year, at the earliest, if ever.
All across the United States, you're starting to see businesses reopen. And I think what the federal government did was place the liability onto the states to reopen. And when that happens, every state is gonna be different as far as how they handle and when they open up the businesses. The key is going to be flattening the curve and controlling any new cases. We want to make sure that we continue on the downward trend. We've been doing great, but as we start to open up businesses, and if we don't have controls in place, we're going to see that downward trend to change. We've even seen terminology change over the last few weeks, and the mayor has changed some of the wording. Now it's we're calling it stay in shelter, and stay in shelter is a little bit more broader, a little bit more looser as far as what businesses and individuals can do. But again, it's going to be up to your business to really control and minimize the exposure of COVID-19. It's very important for businesses to get back to work, but more importantly is to have that formal approach when coming back to work so that you can control and minimize your exposure. And this slide basically from the city and county of Honolulu just demonstrates how they've been following the reopening of businesses. As you can see, you have from low risk to high risk. Right now, we're kind of right in the middle of opening up retail with a modified approach. And so as the weeks progress and as the downward trend continues, you'll start to see the more higher risk industries open up. Before we get into a formal approach to COVID-19 and getting the employees back to work, We had discussed some of the challenges that at the beginning of the presentation, that you will probably see, whether it's, the difficulty of an employee getting back to work. Childcare is a big thing, and uh, having them make sure that they can get childcare back, getting kids back into school. It will take a lot of coordination on their part. Getting employees back to work in phases versus all at once is a good idea, because once you start placing the controls in place and having uh, not the entire staff back, it'll allow you to make these changes along the way, so that you have all the controls in place that are effective. So you want to make sure that you don't bring employees back too soon, and making sure that everything is in place, and ready to go. And just remember to keep things in mind that an employer, you are obligated to providing a safe workplace under the Occupational Safety and Health Act. So that's why Atlas Insurance is recommending a formal approach to COVID-19.
So what do we mean by a formalized approach? Really, we would like to see your plan of action on paper, essentially. And so we want is policies and procedures, or guidelines and best practices that your company will adhere to, and then also be able to provide guidelines for your employees as they return to work. Now, here we just want to be able to talk about a back to work plan, which is a little bit different than return to work. I know that that's been used very loosely as we begin to reopen our business, but return to work really is talking about workers' compensation claims, and a back to work is where we're at with the pandemic. So as you see on your screen, it's an action plan that's editable, and it's an example of something that we can provide you as a resource. If you are at the beginning stages or the middle, or maybe even already have one completed, but you may need more information to make it a bit more detailed, we have a library of references available to you that can help complete this formalized approach. In the next few slides, we'll discuss guidelines you can incorporate into your back to work plan. And just as a general overview, it really will not answer all of the questions, and it may not fit your business needs, but our hope is that it will trigger some thoughts or trigger some questions that you can either add to your back to work plan or update your back to work plan. So we really want to make sure that you have a statement of commitment, and this statement really is from leadership, right? This makes sure that everyone from top down is bought in and they understand that your goal is to provide a safe and healthy workplace. Then you want to talk about prevention. So you may already have some of these practices in play, but you will certainly want to make sure that you are addressing specific topics such as social distancing, temperature checks, masks or PPE, and then cleaning and disinfecting. And as you're building your back to work plan, you also want to make sure you address the responsibilities of your employees. I think that's very critical as well. A big topic is sick employees and absenteeism. We know that a lot of our services are interconnected, and so you can't have childcare. It's difficult for you to go to work. If they're not in school, someone has to watch them, and there's no childcare, it's difficult for you to go to work. And so those are some of the topics that should be considered. Within your back to work plan, you could also reference an update or an amended or added policy or procedure. So I know some companies sent their employees home to work, right? So now teleworking is part of their new norm. And so we want to make sure that you address that information or those needs specifically, because there's just a different set of requirements with technology and security and all those types of things. And we'll discuss that a little later. Another policy procedure that you might want to update is your flexible sick leave. And there's a lot of laws mandated now. I know there's a lot of information out there about who qualifies and who doesn't, and so you want to make sure that you certainly address that type of policy. The next section you'd want to add to your guidelines or back to work plan, you definitely want to make sure that you talk about best practices moving forward. Now, we've heard all about some of these, right? Respiratory etiquette, hand hygiene, business travel precautions, and meetings and gatherings. But you want to make sure that these are specific to your business and that you address them here, because this is really what you're going to be asking your employees plan to action, right? This is your saying, this is what we want you to do moving forward until we change otherwise. And the last topic I believe is important is everyone's mental fatigue, stress, or anguish, because everyone handles stress, mental fatigue, and anguish differently. And so if you have employee assistance programs, or if you have a way to communicate with your employees, I think this is a really big topic moving forward as far as safety and risk that most people do not consider, but we think that you should at least keep your options open in discussing this topic.
You know, for those employers out there that are familiar with having a safety program, company statement of commitment is a common thing that you'll see at the beginning of a written safety program. And it's really just the company's commitment to providing a safe working environment for employees. And what we're recommending is having a company statement attached to this policy so that employees can feel comfortable that you as a company are committed to providing a safe working environment according to the Occupational Safety and Health Administration. This is a vital commitment on every employer's part, and you want to make sure that you communicate it effectively to your employees. We all know as employers that the more time we spend on prevention, you will spend less time on COVID-19. So the more effort you place and placing formal protocols before employees return, you will spend less time on the COVID-19. So make sure that you take the time to have a formal approach so that you can reduce and minimize your risk and exposure. And the prevention, if you spend the time on prevention, it'll pay off in the long run.
And as Vince has mentioned, we certainly want to focus more on the prevention side. So social distancing has by far been the largest topic of conversation. We've all had to adhere to some of the guidelines and the mandates by the state. But really what it means is, avoiding large gatherings and maintaining distance from one person to the next by at least 6 feet or 2 meters whenever possible. So the next few slides will detail a few of the practices and best practices you can put into your guideline moving forward. So when it comes to some of the details in social distancing, I think it really depends on your work environment and how you go about doing your job. And so some areas, these examples might be quite simple to work with, and there may not. Maybe you work in a warehouse or maybe you work in an environment where you can't be out of the office, or you have to be by the phone, or you have to be waiting for customers. So, some of these things might work, some of these things might not work, but at least it'll get you thinking. So some of the things that we've thought about that you can incorporate as a best practice would be flexible rotation work hours, so maybe morning and afternoon hours, alternating workday rotations, so Monday, Wednesday, Friday, or Tuesday, Thursday. You could also consider restructuring office seating, making sure they're 6 feet apart, and then even consider telework, right? You can be flexible in having your employees work from home. And again, there's some other parameters around that, security, ergonomics, right? Other things that you need to consider, but you want to make sure that you have all options available so you can reopen your business safely. And these set of examples are more for shared or common areas. So if you have a waiting area, maybe folks can't loiter, or you make sure it's by appointment only so they're not hanging around. If there's restrooms, depending on what size, how many individuals can be in there at a time, maybe one or two only. Lunch room and break room areas might be based on size, maybe only one person at a time in a break room if it's small, or maybe, and so that'll require you to stagger breaks, right? Lunchroom, same thing, that might require you to stagger breaks and maybe spacing between seats and tables where folks can sit. So again, these are just some best practices that you can incorporate. Doesn't mean it might apply to you specifically, but at least it will get you thinking about how to incorporate that within your guidelines in your back to work plan. And finally, the last set of best practices pertaining to social distancing really reflects the interaction between customers or visitors to your place of business. And so you really need to have a good set of guidelines as to where folks should wait or drop off items. And so we encourage you to adopt technology, right? Because delivering services remotely might be the best option, where they might have a no contact policy where they'll leave your item at the door in the lobby. If you have let's say a delivery and receiving area, do you have guidelines where that might be disinfected or cleaned periodically because it's a high traffic or high touch area? So managing and controlling and having a sensor area for that will be important. And let's say, for example, you might have a mailroom. So how are you managing incoming mail or outgoing mail? Are you having visitors walk in? Or are they leaving it in a certain area? Is it being disinfected before you distribute it throughout the office? And so we really hope that these last set of examples really allows you to add to your current back to work plan, or even add a new section there.
Temperature checks have been kind of one of the more, I've seen a more frequency of discussion on temperature checks recently. On March 18th, the Equal Employment Opportunity Commission gave the green light for employers to take the employees' temperatures. Whether you mandate it or you do self-checks, it's really going to be up to your company to make that decision. So right now, our company is looking into thermal temperature checks before they come into the office. And so there are companies out there right now that are selling these products, and companies are currently looking into it. You don't have to get a thermometer. There's other types of devices out there that, such as the forehead temperature check or thermometers. So you want to make sure you have the devices, because they're hard to get as well, before you open up the office. So whether you're mandating it before they come into the office and you become responsible, or you hire a vendor that would take the temperature checks for you, there's also self-checking. I'm not sure how effective that will be, other than if the employee starts to feel ill, you have the thermometer available for them to take their temperature. The whole point is you don't want them in the office or in your operations with a fever. I think where most employers are going to be challenged with is, how do you know the person has a temperature or not? Especially if you're encouraging everybody to come back to work, especially if they do not have any sick leave or vacation left to take. These are things that you will have to consider, because the employee would feel that they need to get to work sick or not. So how do you control that? So remember, some people with COVID-19 do not have a fever, and some people with a fever do not have COVID-19. So the question becomes, so what do you do? Well, it goes back to what we've been discussing with you today, is focus on the prevention. Prevention is the key to reducing and minimizing your exposure to COVID-19.
The next topic of prevention you could include in your back to work would deal with mask guidelines. And if you already have personal protection equipment guidelines, you can certainly adopt some of these practices to include within your own current policy, because there might be positions where folks have never worn masks before. So you'll need to include that population in your new guideline. But what if you've never had to offer PPE to employees? This is where you decide what's best for your company or your organization. Now, if you're going to provide masks, there must be some type of protocol compliance with that. So you certainly need to educate and train your staff on how to wear it properly or how to dispose of it properly, right? Along with the compliance piece, you need to document. So in order to be consistent across the board with all employees, documentation will be very helpful. Now, the state has asked the general public to wear cloth masks, and so it can be confusing at times. And the CDC has done a really great job in showing people how to make cloth masks and why masks are important for safety. And so you can certainly adhere to that, but we want to make sure that you understand that whatever path you take, we ask and we encourage you to have a protocol and then just adhere to that protocol and be as consistent as possible and provide documentation if asked, just in case something might come up at a later time where someone said, hey, I wasn't asked or told to wear a mask at work and now I'm sick. So again, if you're going to ask someone to wear a mask, please be aware that it does come with some compliance. And if you're not going to, again, you want to also be aware that also comes with some compliance as well. Along the same guidelines as with mask protection, cleaning and disinfecting is a really important topic. So we would like for your guidelines or your back to work plan to incorporate a few of these ideas. So if you have porter services, do you increase the frequency of cleaning common areas or reception areas or high traffic areas? Do you use a vendor to spray down certain areas of high traffic or just in general? Maybe your employees clean throughout the day to help. So what areas do they clean and how frequently do they clean those areas? Think about break rooms. How many people might touch a microwave or how many people might touch elevator buttons? You also want to make sure that employees are frequently cleaning their own personal space. So their workstations, their keyboards, telephones, and you want to also make sure that there's a protocol for cleaning common areas like printers or fax machines and those types of items. And you really want to ask your employees not to share personal items. So we want to try to mitigate that as much as possible. So don't share your phones or don't share other tools. But if you need to, just make sure there is a procedure to clean and disinfect them before and after. And really understanding that cleaning and disinfecting are two steps. One, you'll use maybe soap or detergent and water, and that would be cleaning the surface. And then disinfecting the surface will require you to use some type of disinfectant. Usually we'll have a chemical in there that will help kill a bacteria. So two different steps there. And then finally, you want to make sure that you have access to these products. So if you're asking your employees to clean or help assist in cleaning, making sure you have enough products and they're accessible. Now that we've addressed the prevention piece to your back to work plan, another very critical piece is employee responsibilities. And I'll only take a moment to discuss how important it is here because really this is based on behaviors of employees to adhere and to follow protocols that the company sets forth. But I feel that if you have really good communication and you've been as transparent as possible with everything that's going on, employees are eager to come back and comply to whatever needs to happen for them to get back to work. So if that means they complete a questionnaire before returning to work, although some might think that's too invasive, if they understand the reason behind that, then maybe they would understand why it's important to keep a safe and healthy work environment for all. They would have to adhere to some of the social distancing or PPE or cloth face mask wearing best practices. Because again, we're trying to ensure a safe workplace for all, not just a few or not just one. There might be a change in policies. Maybe you're going to stagger their work hours. Maybe they're going to work alternative days from work in the office and then at home. Maybe your place of business, you don't have the ability to do those types of things, but you'd have to adjust maybe how you serve a customer. Instead of seeing them at the cash register, maybe it's a phone app you prepare and then you put to the side and there's no contact. So they really have to be understanding of the new work practices and what the new norm might look like.
You know, the question comes up quite frequently from clients or businesses is, can you utilize an employee questionnaire? And, you know, the CDC currently recommends against requiring certifications due to the potential burden on healthcare providers. In other words, they don't want you to require an employee to get a certificate saying they don't have COVID-19, so now they can return back to work, because that'll just burden the healthcare system. So what do you do then? Well, you know, we recommend working with your HR department to develop a questionnaire, but it would be more specific to COVID-19. You have to make sure that you follow the guidelines that are under the American Disability Act, the ADA, and make sure that the questions that are asked are non-discriminatory. Things that would be related to COVID-19, such as fever, fatigue, cough, sneezing, aches and pains. You know, are they experiencing any of that? Have they recently been in close contact with anyone who exhibited any symptoms of COVID-19? Have they recently been in contact with anyone who has tested positive for COVID-19? These are just some of the questions that are specific to COVID-19 that can probably be placed on a questionnaire that you can require employees to complete before coming to work. Traveling is another one in the travel restricted areas, those kind of things. When you create your formal written program, you have to have a section in regarding employee responsibilities. You know, employees have just as much responsibility as the employer, and that employees must take the steps to protect themselves as well as other employees in the workplace. Stating that, you know, they need to stay home if they're sick and get medical care. Inform their manager if they have a sick family member at home with COVID-19. If a sick employee is suspected or confirmed to have COVID-19, you know, and making sure that they inform the employer. One of the areas that I think most employers need to do or have ready before employees come back is a vendor contract with a cleaning and disinfecting service. We're fortunate in our office to have a great vendor that was already contracted through our building, but we contracted them separately to do spray down services every week. Yes, it's an added cost, but it's also another prevention method. And so this spray down
basically takes a few hours a week, and they spray down all the furniture and carpet areas, common areas, and it's just another way of uh, or another prevention mechanism for your program. But going back to the sick employee, is if you have a COVID-19 confirmation of it, and you find out that one of your employees was sick, they went home, they found out that they went to their physician and they found out they have COVID-19, then you have to immediately take care of that area where the employee was working to prevent more spread within the office. And again, we don't recommend the employer actually going in and cleaning it themselves, but we recommend having a vendor or a contract with a vendor that can come in and do the cleaning and disinfecting uh, uh, regarding a COVID-19 case.
In this section, I'd like to discuss our resources available to you. So if you were to go to atlasinsurance.com, you'd see that we have a COVID-19 section. And this is general information and updated information we've provided that's accessible to everyone. But if you needed something a bit more specific, or you wanted to add to a current policy, you can certainly contact us and we could provide you some form of template of the guideline or policy that you're seeking. And the next few slides, we'll talk about what we think about when we talk in relation to adding a new policy, and then we talk about a few best practices as well. So here you have a teleworking policy that is not necessarily a policy per se, but we think about the pros and cons and the legal issues attached to teleworking. And when this pandemic started earlier this year, and as folks were pushed out of normal work environments into their homes, there was very little time to discuss and to set procedures in motion and have proper protocol to have folks working from home. So maybe now you've had some time to adjust, and maybe some things have changed and your company has adapted a bit. But now now's the time to go back and maybe revise some of those policies and those procedures that work really well or maybe don't work that well. And so this, again, just want to trigger some thought behind this type of policy. The next policy that is very popular is sick leave. And as Vince has mentioned before, there is a lot of regulations and there are some new laws out there. And so we encourage you to go look for that information because there are definitely some qualifiers for employers and some qualifiers that employees must have to receive some of these benefits. So you need to understand how it works, right? How are you going to use your paid sick leave, and what kind of notice requirements do you need to provide your employees? What does a compensation look like when you do pay out? Is your company entitled to some tax credits? And how are we going to enforce this? And so as you start to add or maybe adopt these new policies, it's always great to have some type of resource that you can tap into. And so right now there's a lot of information, and so we would recommend that you utilize the policies that best fits the needs of your business. Along with sample policies you might incorporate in your back to work plan, you might want to incorporate updated best practices. So I know we've all probably been doing them, but do you have them written down? Is it in your plan? And if not, here are some pieces that you can incorporate. So respiratory etiquette, we've understood this is really important in mitigating how it's transmitted, either through touch or sneezing, or social distancing, right? Disinfecting, or even just staying at home. And another best practice would be hand hygiene. And we might be practicing this already, but having it in your plan is important. Making sure that you detail it, because for your particular place of business might be different. You might need to include frequency. You might need to include a specific type of alcohol-based hand rub that your company uses. And then also you might need to make sure you update your SDS, having that SDS sheet reflecting what kind of alcohol-based hand rub you have and the safety behind that as well. So another section that you could incorporate and update if you haven't done so already.
You know, business travel is such a big challenge for many companies in the state of Hawaii, because many companies need to do business travel, whether it's neighbor island or to the mainland. But I think this whole COVID-19 situation has made all companies rethink the way we do business. You know, companies will need to rethink the way or the need for travel to meetings and conferences. You know, whether they're doing more virtual meetings or can attend virtually rather than going physically. I do know that, you know, for our company as well, we eliminated all travel until we feel it's safe for employees to travel. But you know, the main thing here is to check with the CDC's travelers' health notices and obtain the latest guidance and recommendations for travel, because it's constantly changing, and the CDC is probably the front runner of providing these notices specifically for traveling. You also want to place this into your policy and procedure, and to make sure that if employees have to travel, that they understand what are the protocols if they're traveling to the mainland or even out of country, and what are the protocols they would need to take if they get sick while on a business trip or during travel, and they're not familiar with the medical system up there. So making sure that they're prepared in case they do come down with getting sick during business travel. Regarding meetings and gatherings, this is really going to go back to social distancing. You know, you not only want to strategically place individuals within your office or making sure that they have 6 feet distance from one another, but also you got to start looking at how you're going to control the vendors and client meetings, internal meetings that would which would be more in the small group category. Well, what is that? What is that amount? Is it 6 employees or less? And what rooms will be utilized for these meetings so you can have 6 feet distance? You know, are the offices that you have large enough to have 6 feet distance and be utilized for meetings? Even if our offices here at Atlas are large enough, we have decided to not have internal meetings within the private offices and to utilize conference rooms or the boardroom. And then embrace online platforms as an integral part of hosting or attending meetings. In other words, take advantage of your technology and continue to utilize programs such as Office Teams or Zoom, just to make sure that you continue your efforts in the social distancing. I think what's really important is making sure that you don't rush into starting to begin or start to service clients immediately, you know, and is to transition into it and to make sure that you can do the social distancing as best as possible for now, and take it in phases.
This last best practice deals with mental health, and it's a topic that's not really discussed very often, but I'd like to shed some light on it because we're all dealing with the same issue of the pandemic, but everyone's dealing with it in a different way. And so some employers were able to provide benefits throughout the last few months. And some of those benefits have employer assistance programs where folks can reach out and talk to someone. But we really encourage employers at this time to kind of step up and own this piece. And we want you to do that by acknowledging that employee fears surrounding their jobs in the company is real. But we can kind of mitigate some of that mental stress by doing some of the following. So we want to reassure them of their value to the company, regardless of what might happen. We want transparency and some collaboration, especially if you're seeking new ideas to move forward and how to open your doors again. You want you to educate your employees as much as possible about the pandemic. We want you to provide them guidance. So again, this tool right here that you're building is a great way to make sure they understand that their safety is top of mind. And we want you to encourage them to take advantage of any telemental health service out there. We also want you to be inclusive in the fact that, the future of the business really depends on the employees and those front workers. So we want to make sure that you communicate the future with them often. And to be empathetic in your communication, because as mentioned, every employee situation may be different. And the way they handle mental stress or fatigue or anguish is certainly different how maybe someone else might handle the same situation. So we encourage you to please incorporate this and take this on as an employee responsibility in order to get employees back, whether at home or whether at work, in a safer work environment.
Like we mentioned before at the beginning of our presentation, are you learning from this experience and taking advantage by creating an opportunity? So we suggest to pull out the entire disaster preparedness plan of your company and start to review those policies and procedures to make sure that you are prepared for the next disaster. As leaders, I think we've grown from the situation, and more importantly, we are more prepared for something like this to happen again. So review your policies and procedures is a perfect idea right now, especially during this time, and to create a pandemic or COVID-19 pandemic return back to work policy and procedure. You also want to do a technology assessment. I think most of us have done that already, but how do we plan for the future and making sure that we can quickly deploy computers or technology if another disaster hits. And in any disaster, and I've lived through various disasters or emergency situations that have occurred in Hawaii, and I've learned that you have individuals that respond differently to emergencies. And so knowing your strengths and your weaknesses within your organization is going to be vital as well, so that the next time there's a disaster, you have the right team in place to respond to the situation.
So what does the new norm look like? We know that there are guidelines and mandates to reopen business in phases. We understand that employees are suffering unemployment issues and benefit issues, and there are laws that are trying to quickly correct and provide assistance for that. We also know that we've been asked to practice social distancing and to wear cloth face masks while in the public. So those might be new norms, right? Those practices that we're encouraging for you to add in your plan might be here longer than anticipated. So we understand that it's going to take courage for companies to adapt and adopt quickly. We also know that it's going to take a community to move forward, as we've seen in many instances how we're so interconnected with one another. And finally, it's going to take confidence. Confidence in the fact that you're creating a plan today in order to reopen your business and create a safe and healthy environment for your workforce tomorrow. From Atlas, we wish you the best of luck, and we can't wait to see you in the near future. Aloha.
Thank you for joining us today. If you have any questions related to this presentation, please contact myself or Joy Baruso. You can also visit our website at www.atlasinsurance.com, where you find tons of resources and information related to COVID-19. In addition, you'll find a sample policy and procedure that can be tailored to fit your organizational needs. Thank you and have a safe day.